Good morning, everyone. Myself, Dr. Jayanthi V. Sen, dental surgeon under Garji PHC, Gomati District, South Tripura State. Warm welcome all the dignitaries present here on the dais today. We are all here assembled to discuss and take training about MSSKA 8.0, which is a Karyakram under the Honorable Chief Minister Dr. and Professor Dr. Manik Shah, who's implemented this program for building up a healthy edifice in the society with the strong pillars of healthy adolescence. So we need to stress on promoting good health and monitoring their growth right from the newborns, that is from ages 0 to 19 years, so that healthy individuals are produced, their growth is monitored, and it is the responsibility of each one of us to build healthy individuals right from they are born or even before they are born. That is monitoring the pregnant women right from their first trimester of pregnancy or right from the time they have been diagnosed as pregnant.
We can share short videos through WhatsApp, prayer sessions at schools, parent-teacher meetings, special awareness session on impact of IDUs, that is even substance use, intravenous drug users, and also put a ban on teenage marriage and teenage pregnancy, which is causing through our Gram Sabha meetings at the schools and hostels, etc. We can bring in a transformation in the thought process of the parents by counseling the parents and conducting various community meetings too. This reformation cannot be achieved overnight, but yet we all should work jointly together so that we can eradicate this teenage marriages and pregnancy. Unfortunately, Tripura stands the first amongst this topic, so I think it's time we all work together eradicate this teenage marriage and pregnancies, because the adolescent who gets married in the early teens is not fully equipped to physiologically and physically to carry out the responsibilities of the of maternity and also help the child to grow in its full development. So we have to put a ban on this teenage marriage and pregnancy. Now, on other activities under MSSKA 8.0 are we all are aware of NDD, that is the National Deworming Day.
So coming to MSSKA 8.2, and this program is going to be there with effect from 24th October 2025 to November 6th 2025. It's our responsibility to abide by the rules, the terms, and also the rationale, the strategies, and implement them successfully and train our subordinate staff and the health workers, the frontline workers, so that we can successfully achieve the target in screening the population and community-based screening, the population-based screening, and achieve good results. Thank you.
The full form of MSSKA is Mukhyamantri Shustu Shoishab Shustu Koishor Abhiyan. This is a jointly implemented health program through a community-based door-to-door approach as an alternative strategy amid the COVID-19 pandemic to sustain routine interventions. Here, our frontline workers, ASHAs, are trained to doorstep delivery of multiple health programs and the targeted populations with safe interaction with the beneficiary households, targeting mostly on the intersectional age group of 0 to 19 years, covering their major health initiatives, that is the nutrition, immunization, reproductive and child health. Here we've already been doing the MSSKA 7.0, and there is an extra add-on to this MSSKA 8.0, that is the Child Abha ID creation through Yuvan app. As usual, we have been doing under MSSKA 7.0, the Gram Sabha and special session on teenage marriage and exclusive breastfeeding, HBNC, that is the home-based newborn care, HBYC, the home-based care for young children, and awareness on teenage marriage and exclusive breastfeeding. We are also conducting adolescent health programs, Beti Bachao, Beti Padhao programs and initiatives, and we are also the National Health Adolescent Program, RKSK programs have done huge initiatives to upbring and uplift our teenage group and the children. Right from their early, middle and adolescent age group. And again, the national immunization schedule have laid a big support to prevent major illnesses like polio, measles and so many other diseases, and immunization has become a boon to the society, right from newborn to till the geriatric. We have a schedule of national immunization. We'll discuss about it later. Then coming to AFP, that is acute flaccid paralysis surveillance, and MR, measles, rubella surveillance, social awareness and actions to neutralize pneumonia successfully, that is SARS, and implementation of tetanus diphtheria vaccine to 10-year age group and 16-year age group under vaccination program, and Poshan Abhiyan, the growth monitoring, and IDCF, the intensified diarrhea control fortnight. Then the WIFS iron folic acid IFA supplementation program. WIFS is weekly iron folic acid supplementation program, and VAS, vitamin A supplementation program, and NDD, National Deworming Day. So these are the major initiatives implemented by our government for the eradication of many childhood illnesses and in creation of healthy young adults so that they can be a strong edifice to our society. Now, coming to the major stakeholders, who's going to take up all the initiative? It is we all of us together should work, and our first primary frontline worker are the ASHA, then the AMM, the MPW, CHO, and through the ASHA facilitator. We have three departments. The three departments are Education Department, Health Department, and the social workers and the Anganwadi workers and ICDS supervisors. And again, we have the TRLM group which will actively take part in this initiative. The school department, the education department, our great teachers, the government and the government aided and private school teachers play a major role in this initiative too. Now, coming to what are the intense public awareness and mobilization under MSSKA 8.0. So we know the mass media, newspapers, advertisements, radio, jingle and TV, they all form a very major public awareness mobilization program. Other tools for mobilization of these public health programs and awareness, and we have mass media, newspapers, TV, and we have mid-media, that is the press meet, launch at state and district level, miking, hoarding, posters, leaflet, pamphlets, and sending SMS alert by private telecom service providers, etc. Then we have social media, the Facebook, Twitter, YouTube, Instagram, etc. We have IPC, the interpersonal communication. Then we have door-to-door visit, FLWs through the frontline workers, and through also the banners play a major role in the interior tribal areas and areas which are hard to approach. And we have
twice in a year, that is every 10th of August and 10th of February, we observe National Deworming Day. It's done to prevent and control soil transmitted helminthic infections, anemia, and also factors which are responsible for impaired growth, physical or mental growth development. Symptoms of worms can be abdominal pain, malnutrition, anemia, and other health issues. After deworming, children are advised not to consume processed foods or sugary foods or hard to digest food like red meat or some dairy products. Instead, they are advised to take yogurt, probiotic, fiber rich foods, fruits, and vegetables. So, health department should be well equipped with adverse event management strategies like anaphylaxis kit and emergency medicine kit. Ambulance service and RBSK team cab in cases of emergency should be ready, along with AAFI kit in all hospitals. National Adolescent Health Program is doing wonderful jobs in creating awareness programs for the school children. They are instructing them to maintain the personal cleanliness, hygienity of their hair, skin, nails, and also avoid smoking, drinking, taking in alcohol, and also stay away from substance use or drug use. And adolescents are now equipped with online education platforms, free tutorials, and also access to use their laptops for higher education. They are promoted for higher centers for help, emotional, psychological help. National Mental Health Program is also doing wonderful job in creating awareness amongst teenage group to refrain from aggressive behavior and to stay away from harmful thoughts of suicidal tendencies, etc. So with this I also want to stress about the danger effects of use of tobacco, as tobacco is the one and only cause of causing cancer. So I request all the children of adolescent as well as every individual to quit smoking as quickly as possible. Tobacco cessation programs are doing great jobs and bringing a lot of reduction in the use of tobacco and its danger effects. NCD department is also doing a great job in training and bringing awareness and educating the public and bringing down the oral cancer incidence and also in management of the already affected. So with this, we'll wind up. Thanks each one of you for sharing your precious time and making this program a success. Thanks each one of you for giving me this opportunity to discuss and share whatever little knowledge I have with you all for the benefit of the society. Thank you so much.